right. Hi, everybody. Thanks so much for joining me today, Mr. Buckler, with another interview with another medical professional. This time we've got Amy Sutherland with us. Hi, Amy. How are you?
Hi, good. How are you?
Doing great. Thanks so much for joining me. I'm excited to hear from you and your experiences in the medical field, and I know my students are too, to hear from you as well. So
Oh,
let's just dive right in.
okay.
So. Could you tell us a little bit? So, how long have you been in nursing? And then, and what kind of roles have you been a nurse?
Yeah, I have been a nurse for 7 years, almost eight. I got my bachelor's in nursing at Lee in Cleveland, down the road, and I knew I always wanted to go into pediatrics, and so I went into the Children's Hospital pediatric residency, where they rotated us a week in each unit at the hospital,
Mhm.
and then we got to pick our favorite, and we got matched. And going into that week, I wanted to take my NCLEX, the test that you take at the very end of nursing school, during the week of the NICU because I told my husband, yes, we were married at that time, that I wanted nothing to do with the NICU. I was so afraid of teeny babies. I wanted
Mhm.
to skip the week and be there as little as possible. But I was so thankful for the residency program because I'd never even stepped foot into the NICU before saying I didn't want to do it.
Mhm.
But once I got in, I had an amazing nurse I shadowed for a few shifts, and it ended up being my favorite, my first choice. And I loved it. So I was there for 6 years as a NICU nurse. And then I recently, maybe about a year ago, switched into an office setting. So that's where I'm at now.
Nice. That's so
Yeah.
cool of hearing like how God used that time to draw you there, especially since
Yes.
like that's where we met. My wife and I
Yes.
and you and your husband met through that in crossing with our oldest daughter, Evie, who was
Yes.
in the NICU for 75 days at Erlanger, and then
Hmm.
that followed up with our second born, our youngest now, May, who was in the NICU for just a little
Yes.
over 24 hours, but got to be
Yes.
at a different
Different
hospital
hospital.
with you, different
Yes.
NICU, but
Yes.
yeah, such a sweet connection that we've made
Yes.
through really hard times, and we'll get to that in a
Mhm.
second. Really hard
Mhm.
times for us, but like really sweet to do that with good friends
Mm.
through that. So. Um, why don't you a little bit more? Could you tell us a little bit more about your education and what that looks like for a nurse in particular?
Yes, nursing school. I went to college for 4 years, and so, it was a four-year program, so I did get my bachelor's in nursing. Yeah,
Nice.
you can
Um,
continue after that,
mhm,
um, if you're interested to be a nurse practitioner, which is incredible. I'm not really sure how many more years, a few more years after that,
mhm.
um, but yeah.
Did you grow up in this area?
I did not. I moved around a ton growing up. I
Okay.
claimed Florida because I was there the longest.
Okay.
But I went to a couple different elementary schools and a couple different high schools, which was difficult.
Mhm.
But then I ended up going to Lee
Yeah.
in Cleveland. Yep.
Yeah. What drew you to Lee? That's kind of where I was heading with this question.
Okay. Yeah. I at the time my parents lived in Nashville.
Mhm.
Um, I graduated high school in Nashville, and then I went to a little country in Africa called Burundi for a few months.
Mhm.
So that technically was going to be my first semester of college.
Mhm.
I got back maybe a few days before Christmas in December, and I think my parents thought I might just take that semester off and reevaluate things, but I just didn't want to waste any time, I guess.
Mhm.
So I had one really good friend from my high school that was going to Lee already at the time. So that was the only school I applied for, and I just went there.
Yeah. The rest is history now.
Yeah.
That's cool. So. Well, why don't you tell us a little bit? So, like, what's your why for becoming a nurse? Like, why a
Mhm.
nurse in particular, and why and still a nurse, as
Mhm.
well, just in general.
I think the household I grew up in, my dad was very career oriented and kind of drove in us work, I guess. And I think I would say I had a passion for getting a degree where I knew I could get a job after.
Mm,
So I think I was driven to knowing that nursing could provide a good job right
mhm,
after college. And then also, I feel like the Lord put it on my heart in maybe early high school, maybe even late middle school, the idea of a pediatric nurse. I remember telling my family I had a goal of being a pediatric nurse practitioner before I realized how much school that nurse practitioner part meant.
mhm,
So I kind of stopped at pediatric nurse, but yeah, it just kind of landed on my heart. And then also the fact that it's a great job and you can get a job post college.
mhm.
Knowing that I would have debt, um, I just wanted to go to school, I guess, knowing that I could have a career. I'm
Yeah.
not sure if that's a great way of looking at it, but
No, but I mean it's a
yeah.
fair thing, like to be able to provide for you and your family and to have that security. I mean, that's what
Mhm.
like we all at the end of the day have to be able to do is
Mhm.
provide for our families. And so yeah, that's I mean it's a great reason to be able to do that. And um yeah, and from firsthand experience, I think it's been a great thing for you to be able to do as well to see how you interact um on the job and then with other families as well.
Oh,
Um
thanks.
Yeah. What so we're getting into the body systems now at this point in time as our class. And so
Mhm.
we're going through all the body systems and really getting like a super basic overview of each one. Um and we're starting off just in seventh grade. This is most they've gone into body systems at this point in their schooling. And so there's a lot to take in, but then a lot we're leaving out. Could you tell us a little bit? So, like, how does learning about the body systems like help you as a nurse? So now you're doing more oral work, or even when
Mhm.
you were with pediatrics, like how was knowing about all of the body systems important for each of your patients, for little bitties
Mhm.
to now biggers, right, as well?
Yeah, it is so important, and it's all so connected and intertwined. And in the NICU, you have to pay attention to really tiny, tiny changes in
Mm,
the infants, where they can't speak, so they're trying to tell us that, hey, I'm not feeling good. So
mm,
you gotta watch for those signs. Um, Also incorporating the family members because they know their infant. But as far as body systems go, yeah, like um, looking at vital signs, and so all the systems, cardiovascular, every single system, they're all intertwined. And
mm,
I'm trying to think back of your question of the importance of it. But
mm,
even if you're not interested in the medical field, just having a generalized knowledge of the body system is incredibly helpful.
mhm. Yeah. I'm hoping that's something that'll impress upon my students, the
Yeah.
importance of it, of whatever they end up deciding to do for a career.
Mhm.
Because a lot of them are pretty undecided at this point in
Mhm.
time, which is fine because they're literally in seventh grade, so plenty of time.
Mhm.
But
Mhm.
yeah, to see value in it regardless of what career. And then also from
Yeah.
like a teacher standpoint, for them to see like how truly like interconnected they are. So we're going through all the
Mhm.
systems like one by one, but like when we're talking about one, we've got to keep in mind the others as well. And
Mhm.
that's helpful too. So like with your NICU patients, right? So those
Mhm.
little bitty changes.
Mhm.
What were some of the things like what were some of the body systems that were maybe the least developed at that point in time of
Mm.
and like these preemie babies?
Yeah. My first answer would be their lungs.
Hmm.
They're very, very underdeveloped. So if you think about the gestation, I can't even think of the word. Oh no, I've been out only a year and a full term infant should be
hmm
in the womb for 40 weeks. And so some infants are, for various various reasons having to come out of mom way too early, months early. David knows this very well.
Mhm.
So you could have a baby born at 24 weeks, which is very, very early when you're
Mhm.
looking at 38 to 40 weeks being full term.
Mhm.
So every system is very underdeveloped, but especially the lungs and the heart. So when they are born, they come out. Usually a full term infant would be able to take that first breath outside in the world when they are born. But with them, typically they would have to be intubated because they need help breathing on their own.
Mhm.
So we have machines, ventilators that can breathe for them. We have all sorts of machines and medications to kind of help them um, achieve homeostasis, to make sure all their systems are aligned and their vitals look good. And another thing that comes to mind is their temperature. They have a really, really hard time maintaining their temperature as well. So we'll keep them in a little box, I guess, an isolette that keeps them warm in there because the more they're trying to keep their temperature up, they will start losing weight. So
Mhm.
we want to just provide a warm environment, a very quiet and dark environment like the womb was, but now they're outside of the womb, and so we try to simulate that
Mhm.
environment.
Yeah.
Yeah.
That's an interesting thing. Like even with me, like who's had two babies in NICU, one for like a crazy amount of time, but even still, like
Mhm.
learning things about this process, and like making those connections between what I saw being
Mhm.
done with Evie in the NICU,
Yeah.
to why those things are done that way.
Uh-huh.
That's
Yeah.
a helpful thing to see.
Yeah. You would think that when we get sick, adults, our temperature goes up, but for these little babies, when it starts to go down, that's telling us they're getting really, really sick.
Mm.
Um, so that's an interesting thing with infants. But I
Yeah.
think we might touch on this later with families. But that came to mind when you were saying, like learning the whys.
Mm.
Why do we do certain things? Why do we tell parents not to touch their baby? That is so
Mm.
not it just doesn't seem okay to say that, but I
Yeah.
think the more you educate the parents and the more you tell them the reasons behind it and why it's better for, um, the baby, then everyone can be on the same page. I feel
Yeah.
like I was really passionate about explaining things because sometimes I'm sure my girls didn't have to be in the NICU, but I saw a lot of parents, just stressed and not understanding why we're telling them certain things, so I don't know, I felt like I could bring kindness into a situation and explain some things.
Yeah. Being that kind teacher, um, which is a great thing to for me to reminisce on and to appreciate
Mm,
as well. The nurses, the numerous nurses that we've had, um, between our two daughters,
mhm.
and the care that they gave not only to our daughters but also to us, to take that time to educate us on the whys and what the numbers mean and all
Yeah,
of that. Um,
yeah.
so yeah, like let's dig into that a little bit more. So like with your NICU experience in particular, how
Mhm,
have you been able to kind of minister or care for those families? Beyond just educating, I think that's a huge one. That's definitely number
mhm,
one. Were there any other ways that you could minister and did minister to those families as well during that probably honestly one of the hardest times of their lives? To
mhm,
have their newborn baby, the baby they've been anticipating for a while,
mhm,
whether that's for, as you said, 24 weeks or um like oh what 36 weeks in that range, right?
mhm,
That how um wide of a range that can be and how premature they
mhm.
could have been. In what ways were have you been able to minister to them?
Having to be told that your baby is not going home with you when the mother's ready to be discharged is
Mm.
something I cannot comprehend because the NICU, most people don't know it exists,
Mm.
and that's a good thing if you don't know it exists, but when you, have to experience the NICU and when a doctor comes in and says, "Hey, we have to take your infant," um, it's a very negative situation. No one wants to be into the NICU, I guess is what I'm trying to say.
Yeah.
you want to give birth and then go home to the crib and the room that you decorated and painted, and so it's just so out of your control. Everything is out of the parents' control,
Mm,
and before the parents came in, I would try to make sure. Now this might seem silly, and I don't know if it's answering your question of how I ministered to them, but I would try to make sure that the beds were clean, the linens were clean, there was no spit up anywhere, the drawers were stocked and they looked organized, and that I would greet them when they came
mm,
in, especially if it was their very first time walking into the door. It can get kind of noisy. There's some babies crying, alarms going off, and walking in there for the very first time, especially if you don't even know where your infant is,
mhm,
I just can't imagine that. So I guess I would say greeting them, just being kind to them, directing them where their infant is,
mm,
and then just kind of feeling out how they are emotionally. If I need to say, "Hi, I'm Amy. I'm your nurse today. I've been taking care of little Evie.
mhm,
Do you need a moment? Do you want me to come back?" I just wanted to make sure, like, you knew we're here, we see you, and I'm gonna be your nurse today. Um, and then just kind of feeling it out instead of, I just saw a lot of some coworkers doing things differently and the reaction of the parents. So I guess just leading with kindness and
mhm.
understanding that it's an environment no one wants to be in. So um, letting the parents participate when they can, and then like yeah, educating like we touched on.
Yeah.
Yeah.
Honestly, yeah, that goes so far. And I'm like trying to not get emotional right now, but like that
Oh.
really does go really far of
Mhm.
like each new nurse that we had through, especially with Evie, right? Because we're there
Mhm.
longer. Each nurse that was intentional to greet us and to fill us in on what
Mhm.
had been going on. But yeah, especially that first night, that first day, or for us, it was that night, with Evie of like coming in and being very disorienting. And like you said, like having everything at the house ready and not
Yeah.
going to the house, is definitely a painful thing. And then going to her area, her pod, and seeing things mindfully put together, and people greeting us with kindness. Yeah, that really does. Definitely,
Mm.
probably more than you saw or realized or was vocalized to you in a way like this, but like
Mm.
that really did go so incredibly far to say like your baby's in good hands and cared for.
Yeah.
Even
Yeah.
though, yeah, the situation, like you were saying, is not ideal, like this baby's been cared for. And then especially knowing
Mm.
too, like getting to know the nurses that were also followers of Christ, and
Mm.
knowing that our baby was loved even more than just like any other baby, but like loved in a Christian way,
Mm.
um, and with someone whose ultimate authority and love is for Christ and from Christ. And so, yeah, that really does, that is definitely a way of ministering,
Okay.
um, to families. Yeah, and then educating, absolutely. But yeah, that just the
Mm.
small things, because everything feels
Yeah.
so big. And like for us with Evie, like we were there, I mean, every single moment that we could be. As long as we could, we would leave during shift changes and go home, shower and eat, and then come right back. We
Mhm.
spent holidays there, and like that, yeah, like just being able to be comfortable, knowing our nurses, and them being thoughtful and kind to supply what we needed or answer our questions, um, made a crazy difficult time way easier,
Mm.
on us. um, One less thing to worry about,
Yeah.
than just the general health of our baby. So, I mean, Sarah will stay up, late some nights and just be looking through old photos of our on our phone, and we scroll
Yeah.
through NICU pictures, and we're
Mm.
just sobbing together. And it's
Yeah.
like 11 o'clock at night. We got work the next day, and we're like just
Yeah.
like, oh my goodness. So yeah, it's,
Oh.
I mean, by no means would we want to go back, but it was a really sweet season to
Mm.
see like how God cared for us for Evie's like protection and healing, but then also for his provision, um, for us with nurses and and like et cetera, et cetera. So many things that Lord provided for us.
Mhm.
Um,
I'm so glad.
yes, yeah, what a testimony. Well, every birthday we get out her little diaper. I should have gotten it. I'll put a
Oh,
picture on
okay.
here.
Yeah.
And it's like barely like as big as the
Mm.
size of my palm of my hand. Like we just get
Yeah.
it out at her birthday and like we'll show like when she was still in diapers, we were showing her
Uh-huh.
diapers, what they were, and like
Oh,
look at this. And
I
so
love that.
yeah, we've got all her little NICU keepsakes tucked away in a
Oh.
box too, and so yeah, it's a testimony for her
Mhm.
and for us of the Lord's provision, and so yeah,
No.
could reminisce forever on it. Um, what advice? Let's keep moving forward, or otherwise I'll keep getting all my
Okay.
soppy sad stories going.
Yeah.
Um, yeah, that's right. What advice would you give some of my students? So like those, especially those students that are interested in nursing and maybe in particular
Mm,
the NICU, because the way that these videos are going to be set up, these my students are going to be able to pick which videos they watch, and do some assignments with that. But they'll get to choose based on their interests. So those that are watching right
mm.
now, what advice would you give them, who are interested in becoming a nurse?
Aw. I think the nursing field is really, really awesome. It, there's just so many different things you can do, like, so many different things. You can let's see, where to begin? If you are interested in the hospital, you can work 3 shifts, and that's full time. It's long shifts, it's 12 hours, but then you get 4 days off in the week. And so if you wanted to schedule yourself, on a Sunday, Monday, Tuesday, and then on the next week, on a Thursday, Friday, Saturday, you get however many days that is in between off, and you can, one day, if you guys are parents, you can hang out with your kids during that time. You could take a little trip. You could, um, I don't know, do a hobby in between that time. So that's awesome. The
Mhm.
schedule part for that, being in a hospital. If you go to a hospital, there's not to be overwhelming, but there's so many different patient populations you can choose to from as well. Neonates, so in the NICU, which I thought I wanted nothing to do of, but it's incredible. You could do pediatrics, which is also babies, but it has to be babies once they've left the hospital. If any baby comes back to the hospital, they don't go to the NICU, they would go to the pediatric floor, up until late teens. There's ERs for adults and kids. There's ICUs. There's so many different avenues just at a hospital. And then there's lots of office jobs too. I keep saying pediatrics because I love kids, but there's pediatric offices. There's probably adult offices. There's oral surgery offices, which is so random but fun.
Mhm.
Um, there's just so many different things. So I think that is really unique and special about the nursing field is that if you try the ER for 3 years and you're like, wow, these cases are really hard
Mhm.
and I think I need to step out of this for a little. You don't need to go back to school. You can just apply to the same hospital even, just at a different floor.
Mhm.
Um, I'm trying to think of what else. What was the question again?
What advice would you give my
Advice.
students?
Okay. Oh yeah. Um, advice. Um, maybe two. Okay, you selected this video, so you're interested in nursing.
Mhm.
Um, Nursing school is really, really hard for me. I was someone who had to study all the time in college, and then I still barely got by on the tests. So I don't know if that's you too, but that's okay. You can still be an amazing nurse or an amazing teacher or accountant, even if you don't make 100s on every single thing, because your test scores don't reflect your personality and the kindness that you can give to patients.
Mhm.
Because that's a huge part of it as well.
Mhm.
Because you're interacting with patients and families when they're having a very horrible season of life.
Hmm.
So you do need to know some of the knowledge that you learned from school, but then a lot of it is talking to patients,
Yeah.
which you don't learn in the textbooks.
I think that's a good encouragement for a lot of my students who feel an overwhelming sense of pressure to
Mm.
they always get exceptional grades each and every time.
Oh,
Um,
good job.
when like their hard work and their determination and their emotional um, intelligence as well
Mm.
can help them to be successful despite what scores they get
Mhm.
throughout school, any level, middle school to high
Mhm.
school and college. But like that ability to care for others, to be there for others, to still be a hard worker, even
Mhm.
though maybe you didn't get the best scores. Like that's fine. Moving
It is.
forward, like there's more to life, so much more to life than just scores. And
Yes.
that's what I hope my students are impress upon them. That I want them to be hard workers, put in effort, and to give it their best,
Mhm.
but at the end of the day, they are not valued or worthy based on what score they have. There's so much more than
Mhm.
that.
Mhm.
Yeah, I think that's great advice. And that's so cool. Like thinking about nursing as a whole field, like you said, there's so many more ways that you've got to be more
Mhm.
specific with that. I need to be more specific with
Yeah.
it in classifying that because there's so much there and
There's
so
so
many
much you can do.
transferable things too, like you were saying, like
Mhm.
which is really, really neat. And that's pretty unique, I would say, to nursing compared to certain other kinds of roles as
Yeah.
well.
Mhm.
That's really neat.
School nursing too, I forgot to mention that.
Yeah, yeah, absolutely. Well, Amy, I'm gonna wrap up with one final question. I
Yes.
like to
Okay.
ask my student or my interviewers this because I know my students, they're in middle school, and they won't be forever, and so
Yeah.
they'll reminisce in ways like this as well. But you said you hopped around schools a bit, but you didn't say you went to two different middle schools. So were you at one middle school the whole time?
I was at 2.
Okay, two. Okay.
Sorry.
You're good. No. Was there a teacher in middle school at either one of your schools who made
Mhm.
an impact on you on your life and who was it and why were they
Aw.
impactful to you?
Yeah, there was. I was new, obviously, we moved around a little bit, so I was new, and that was really challenging for me. Um, but there was one teacher that I still kept up with, via email for years and years later.
Mhm.
Um, I went to a public school, so um it wasn't a Christian school, but this teacher was Dr. Tanksley. I will always remember his name. He actually taught one of the medical classes. So I that everyone did not have to take. You kind of had to just sign up for what interested you, and I signed up for that one. And I feel like he also put a little seed of interest in the medical field, and he was just super kind, and he would pray for me and just he was kind of like a stillness that I needed when, like, my home wasn't as still.
Mhm.
Yeah.
Yeah, that's so neat. And that's yeah, like you're saying, and that's as me too, reminiscing back to really any level of schooling, the teachers that stood out the most to me weren't the ones that necessarily taught me the most or the ones that I got the highest scores in or stuff like that is the ones
Mhm.
that stepped further into my life to get to know me and to care for me personally, not just
Mhm.
educationally too. So yeah, something I pray um, I impart on my students as well. So.
I know you do. Yeah.
Well, Amy, thank you so much for joining
Oh.
me for this. This has been so much fun. I've loved
Oh.
reminiscing with you and hearing about your experiences as a nurse, and sharing so many impactful things with my students. I'm sure they're going to be excited to watch your videos.
Okay.
So, thank you so much again for being with me today and talking
Yes.
with me and taking the time.
You're welcome.
Yeah.
Thank you too.
Yes, so good to see you. Bye.
Okay. Bye.